Okay. So this is our third seminar of the 2023-2024 Gulbria Annual Seminar Series. It is hybrid, and we will be able to answer questions in the discussion session, both online and in the room. But before I get started on the process, I'd like to begin by giving honour and thanks to the Haudenosaunee and the Anishinaabe nations as the traditional inhabitants of the land where McMaster stands. To say that is to acknowledge a debt to those who were here before us and to recognise our responsibility as guests to respect and honour the intimate relationship Indigenous peoples have to this land. The aim of this series is to create opportunities for the exchange of ideas and stimulate discussion amongst researchers, graduate and undergraduate students, community members and older adults. And this year our seminars have been exploring the theme of insecurities. And we're really delighted that for this third seminar, but we've got Dr. Irene Blackberry here in person at McMaster. And her presentation for this seminar is Transforming Care in Older Adults, Innovations from Down Under. This is the first international speaker we've had since COVID on site. So I think it's really great not just to have Irene here, but also to have so many people in the room and also to have so many people online. It's always great to have an international speaker, especially one of the kind of caliber that we have in Irene in the room today. So if you're in the Zoom room, we'd ask you to keep yourself on mute during the presentation to avoid any background noise. The plan is that Irene will present for about 40 minutes, and that will give us about 20 minutes for a question and answer session. If you're on the Zoom room, please type your questions as you go during the discussion if questions pop to mind. Into the chat box, and we can read those on your behalf during the question and answer session, or you can unmute yourself and ask Irene directly during the Q&A. So I just want to give you a little bit of background on Irene. She has just spent some time with our Share Knowledge and Research and Knowledge Translation group, and she probably gave herself a much better introduction than I'm about to do. But Professor Blackberry is the John Richards Chair and Director of the Care Economy Research Institute at the Trobe University. She's over 20 years of research experience across the care economy in Australia and abroad, predominantly in healthcare, aged care and informal care sectors. And I would also add rural, and I'd also add dementia, because that's really from the work that I'm most familiar with of Irene. Her research examines access to care and models of care that are innovative, effective and sustainable, and building skills in individuals and greater capacity of the whole of community to support people from diverse backgrounds in rural communities. More recently, she's been focusing on addressing the care crisis by breaking down the siloing of care sectors. She's the leading force behind Australia's care economy research, including developing an industry-led research partnership programme on the care economy, establishing the Care Economy Collaborative Network and becoming the inaugural director of Australia's first Care Economy Research Institute. And you might actually want to know what the care economy is, but I will let Irene explain that to you. So please, everyone, join me in welcoming Irene to the...
Thank you so much, Anthea, for your kind introduction, and also obviously for your invitation here. And thank you everyone for coming here. You know, I know it's nice and cold outside, but also for people joining online. First of all, I would like to acknowledge the traditional custodian of the land that we're meeting today and pay my respects to First Nation people of the land that we're meeting now in person, as well as, you know, everyone who are joining us online. So pay my respect to elders past, present and emerging, and also obviously acknowledging the traditional custodian of the land that I live in Australia. So map of Australia, I think, you know, most of you would be quite familiar with, you know, where we are and what we do. So this is just, let's see people, so you can see. So this is the whole Australia. We've got 25 million people, population at the moment. So I live in Albury-Wodonga, which is, you know, this is Melbourne and this is Sydney. So roughly about 4 hours drive outside Melbourne. So the primary campus of the university is there in Melbourne, and I am based in the regional campus. So the care economy, I think, you know, I'm not going to talk a lot about that today, but I think would be good to, I guess, you know, for some of you, it's quite a new term that, you know, you've probably haven't heard before. So The vision, I guess, that we're trying to achieve with this is to be a world-leading research and training institute. And the primary, I guess, notion is to improve the health and well-being, but at the same time is to drive the Australia's economic growth by breaking down the siloing of the health and social care sectors. So what we're trying to achieve is obviously to, how we can deliver a sustainable, culturally appropriate, integrated, effective care. And this is across the life's course. So that means, from cradle to grave, from early childhood education and care to end of life care and anything in between. So that includes healthcare, that includes disability, that includes, even domestic violence. So it is quite broad, and we are very fortunate, to receive the 20 million internal investment from La Trobe University last year. And I'm now working with with colleagues, 40 faculty members from various disciplines in my institute. So my research area is primarily sits around older people and healthcare, and that's what I'm going to share with you today. So I do not need to obviously go through a lot, about the aging population. We see that everywhere, and Australia, obviously, and Canada as well, included, part of this, where we can see the increase in the aging population. And as you can see in there, though, that the primary, I guess, in terms of the numbers of people that we will see, the aging population is actually coming from Asia. So we see a lot, particularly China and India. Obviously, Japan is already there, South Korea and Singapore are already there. So just to give you this, see if I can find you might need to help me, equity. Oh, there you go. No, that's all right. Find it now. Thank you. Okay, so let's go with the Australian aging population now. We have, 3 years ago, 4 years ago, it's about 16%. I think it's roughly now it's about, 1 in 5 people are over the age of 65. And obviously the largest, I guess, increase that we see, the growth is from people over the age of 85, so 85 and over. So it is an aging, country. So by 2066, we have, at least 1 in 4, close to 1 in 4, obviously, will be older people. Dementia is at the moment is the second leading cause of death in Australia, and it's a leading cause of death, particularly for women. And we know that, there's quite a lot of Australians living with dementia at the moment. So it's about 400,000 people. And obviously it's going to increase, it's going to double by 2058. And most of the people actually do live in the community independently. So contrary to the belief that, not everyone live in a nursing home. And that, obviously it's costly to care for people with dementia. So this is just an estimate from Dementia Australia. So the current model of aged care, so we have had this Royal Commission into aged care quality and safety a couple of years ago. And, it's interesting that, there's a domino effect, I guess, as part of that, as soon as people hear, I guess how bad the systems, or the aged care systems were, everyone was too scared to go to a nursing home. So as a result of that, there's less actually demand for residential aged care placement. And that's partly also to do with, difficulty finding aged care workers. People are too scared to enter the nursing home. People are too scared to actually work there. So it's I guess, it's an unexpected consequences of, what's meant to be actually, aimed to improve or increase the systems. So aged care homes are closing. So, estimated about, it's about, like one home is, closed pretty much, every month in Australia for the last few months. So it is it is quite a dramatic shift, if you like, in the way the aged care at the moment is happening in Australia. So the government released this intergenerational report recently, and it's no surprise there that people are expected to live longer, and they remain healthier whilst they're having fewer children. So I guess the end result of that is obviously aged care is going to be, or it is now even, one of the fastest growing areas of government spending, and is expected to increase over the next 4 decades. So it's about 5% of the GDP in Australia at the moment is used towards funding aged care. So I did this research a couple of years ago. So I was looking at the administrative data. So we're looking at the census data. So we're looking at, all of the data that are available and do the data linkage, so bring them together and trying to map out, I guess, we know that, we need more aged care. But the question is, like, where do we need the care and how many and what type? So this paper, and, happy to send you the link for the full paper, is to actually show that, if we project the requirement for aged care for the next 10 years, based on the data, based on what we know now, where are the gaps and what type of gaps, what type of care do we need? So this would be useful, obviously, in terms of planning, like planning in terms of the population planning, what kind of workers, required, for each area. So this is the image that show you, where the requirements are and what type of care required. So in the earlier discussion, we talked about the Australian healthcare. So I'm not going to go through this. It is probably as complex, if not more complex than, the Canadian healthcare system. But, we do have this federal, state, and then we have the local government, we have the councils, so multi-tier, multi-level, obviously, funding system. And, as I mentioned before, whenever we have a new government, things change. So with the aged care funding, like previously, the local government, holds, quite a lot of the funding, and then now everything is being held by the federal, and then everything needs to change because of, obviously where the money sits. So it looks quite neat, when you look at it like that, but, in reality, it can be complex. And for a lot of, not only the consumers, but, even for the healthcare providers, it's actually quite difficult to navigate, like where can you seek help, or where can you, seek some funding to actually access care, whether it's a healthcare, whether it's a social care included. So you can see in there some of the breakdown of what type of care and who's actually funding it in Australia. So my journey, I guess, in terms of the rural health research, started off, in mid-2014. And I was fortunate that, in mid-2016 to be able to form, I guess, work with, a number of rural health services. So there are 10 services, so 7 and then plus 3 services that join up, with my university, which is La Trobe University, and my colleague, Professor Jane Farmer, who is at Swinburne University. And together we set up this network, we call ourselves smart people. These are smart people. So we're trying to solve some of the, I guess, issues that, people experience, and trying to work out the whole of community approach to, providing the solutions. So the, what we managed to, I guess, achieve is that, we managed to get over 300,000, within like a short time frame, which is only 12 months. And then since then, we have grown into millions, in terms of trying to get research funding. And we're still collaborating up to now. So, but this is just the beginning of it, in terms of, how we sit together, come together and brainstorm, what are the problems and what can we do together about it. So I'm going to play this video. This just gives an example, I guess, in terms of, like why we're here, like why we're doing the research. Our university and in Australia at the moment, we place quite a lot of impact into what we do. So it's one thing to say that, I want to do research to achieve an outcome, but, impact is way more powerful because, it is actually, what, people on the other end, will actually experience and benefit from what we do. So I'm going to share this with you.
When Dallas was diagnosed with dementia, we decided he was 59, and we decided that whatever time we had left, we would enjoy together. When Dallas was first diagnosed, we didn't know what to do, and about 3 years ago, Dallas took a very sudden deterioration in his dementia symptoms, and it resulted in him having to be admitted to a nursing home. Looking after someone with dementia is very isolating. To be able to get help at your fingertips through an app is just amazing. And to be able to know where the help that for you is local, it's just really good. Verily Connect is really useful because it is online and you can't always get out to get help when you need it. But having it online means that you can go there at 10 o'clock at night and you can get information. It saves you having to go out during the day. And lots of times people can't be left and you need help. And it's nice to know that it's there at your fingertips. Having dementia does it? Yeah. But we get there. I know it's hard, and I know you get very lonely at times. Yeah. You don't live together anymore. It is hard, though. It's hard for both of us. You just make the best of what you've got, don't you?
So that's really, an example of, I guess, like why we're here, why we're doing the research. I think, the why, I think is the, important thing in, whatever we do. Not just because, we've got an idea, we've got a crazy idea, which is good. So I'm going to share with you a little bit about, other things that, that I'm working at the moment. One is around, obviously, around migrant aged care workforce. I have a video here, but I don't know whether I have time to share with you all of the videos. So I can share it with you later if you like, if we have the time. The other part that probably of interest, I know that, we mentioned about this intergenerational care. Now, if this thing works, I will share with you just a snippet of it so that you can get an idea about, what are some of the things that we do in Australia. So.
It's the Generations Music Together program that I'm running here at PhD. And we see that not only are the residents being assisted by the music, but the children are also interacting with the older residents in the way. That's the most exciting thing about this program. So it's all about music across generations connecting through music. So these kids find it quite natural to join with the residents here in holding their hands.
So this is in the nursing home where it has a co-located aged care facility and child care facility. So the program is run pretty much every day, twice a day, afternoon and morning. They have, the kids come, and they develop that relationship with the residents, with the older residents. And they use music as a medium, to actually bridge this relationship. So sometimes they do a craft as well, but it's mostly music-based program. So this is one of the PhD project. One of my PhD students is actually examining and evaluating this one.
Playing these very young children's lives. So for the first thing, music just for music's sake is a wonderful and really important way of learning, way of thinking, way of doing things. The philosophy behind the program is that when children see adults that they care about and adults that they connect with making music, that they'll reach their music potential. So for these children, they're here experiencing this music, and the first thing is it's about the music itself and the value of music itself. But the other thing is that it just goes into every aspect of their lives. So it's a way to connect with their families. It's a way to get through different topics.
So sorry to cut that, but you get an idea of what but because I've just heard from Anthea and from Constance, obviously it's there's an interest in the intergenerational care. So it is quite popular at the moment in Australia, particularly with the 4-year-olds. So people in the kids in the kindergarten, they would go to a nursing home, and they're now trialing, a primary care students, to actually have that program in the nursing homes. So this is, some information about the intergenerational care. So obviously, it needs to be a program. It's interesting when I give a talk, in Asia around intergenerational care program, a lot of people were saying to me that, yeah, but that's what we do, we live in multi-generational, house. But what I'm saying to them, well, yeah, but just because you have an older person in your house, if you're not actually doing a structured program with them, you can't call that you're delivering an intergenerational care program. There is a curriculum associated with the intergenerational care program. So it's not just an ad hoc sort of, you put an older person as a token thing, and then you watch TV together and you're not talking and communicating with the person next to you. That is not an intergenerational program. So that's, I guess, part of some of the feedbacks that, people give me in Asia to say that, well, we're doing it. So we do not need to have, we do not need to run the intergenerational program. So let's just move back to this Fairly Connect, based on that video, the one that I showed you before. It is a big trial that we've completed, a number of years ago in 12 rural communities in Australia. So the idea is try to connect carers of people living with dementia who live in a rural area. Obviously, people are not well connected. So what we're trying to do is, to bring people together, and we developed this online platform to enable them to be connected. So you can have a look at the website, so we've got 12 rural communities there across 3 states, as you can see. And we have also published the protocol, so it's available as an open access online. So we recruited 113 participants, in this big trial, and we developed the platform, and I can show you in a minute, which is this one. So there are 3 things, that we are actually co-designed and implemented. And this is obviously not only with the caregivers or people with dementia, we engage with the volunteers. So it's pretty much the whole of community, rural community, to work together in this project. So the first one is about information. Obviously, there are quite a lot of information out there. But what we're trying to do is develop a local curated information. So, we work with, with this, with the caregivers, to actually have a bite-sized information that people can actually digest and people can actually come back to at the later stage. The other part is also about, information about services. So there are quite a number of services available, but, a lot of people do not know sometimes, the local services that are available. So we try to, make sure that, the services that are listed there is actually applicable and relevant to them. Now, the second part is about, we developed this platform that enable people to actually connect with each other. And that's obviously, it's important, if people want to have a one-on-one chat or if they want to have a chat with multiple people. And lastly is the video meeting. So, we can have like a webinar education or even like a group sort of chat, but it's all done through an online system. So this is just an example, about the guides. So what is dementia, signs of dementia? Is it dementia? Some of the questions that, people ask, and also some information about, how to keep themselves well, how to care for themselves, how they can have some respite, how they can take a break, and so on. And we also engage, obviously, with a lot of volunteers. So volunteers is part of, a big part of this program. So we develop, and train local volunteers. And again, the paper is published there, so you can have a look at what we have done. And some of the findings, I guess, arising from that is that, we see 37% improvement in social support. So a lot of these people, live in quite a remote area. And, in such a small community, sometimes, there's only one of you with dementia. So being a carer is quite, a lonely, I guess, place or space or environment really, because you got no one else that you can connect to. And it's a lot of stigma as well, to live in a small community. So one of a good example of that is, in one of the farming sort of area, that we research on, like the wife was so scared to actually tell people that the husband has dementia, because then it would have an impact on, the value of the farm. Because then, people know that, they don't have a choice, they need to sell the farm. So things that, that I guess, like we don't really think about, that people are actually quite scared about to share with other people. So having that online, ability to, I guess, maintain your privacy and the connection, is something that, people value. And also the flexibility in terms of, you can connect with people at different times. So it doesn't have to be face-to-face. And it doesn't have to be at, 9 to 5, it's pretty much, it's quite flexible. So just I guess, some of the feedback that we receive from people about, they feel that, it just gives them just the right amount of the information, the flexibility, and that additional support that they feel through the research. And aside from the trial, we also do a qualitative evaluation, and here are some of the feedback that we have received from them, that, obviously just too much information, and, the good thing that, we actually simplify the messaging for them. So I'm not going to read that out to you. It's available on the paper as well. And that's the paper that we published last year. So I'm going to share with you another, I guess, example of the project that we've completed as well, that's related to that. And this is another project that's funded through a bequest from Mr. Webster. And the aim is to look at the dementia care pathways. So Bendigo is a regional town, so it's probably smaller to your Hamilton, or probably comparable to Hamilton. So what we're trying to do is, to better support the carers to navigate the dementia care pathways in there. And I'm going to share with you about, how we did this. So the project unfortunately happened during COVID. So, like we plan things, obviously everything face to face, well and truly good. And then, COVID hit, so we had to modify the way we do things. So we did the surveys and the mapping interviews. So we done that mostly online via Zoom with the participants, and we also did the workshop with the key health and aged care stakeholders. And again, I guess, the key message here is that, we actually engage, not only, the people, the carers, but also the local health services, and people in the community to come on board with this one. So what did we find out really from the carers? They want to have, the knowledge and the information to navigate the support services available. They want to have that ability to find that services that fit their needs and preferences, and also the availability and responsiveness of services. So a lot of people find it, a challenge to actually not only to identify, but also to access services in their local area. And we also find that, people wants to be more aware of what local services are available, and particularly with carers, they don't know what they're entitled to. And often, they are actually entitled to get the pension from the government, and many of them, actually didn't know that they're actually eligible to get support from the government. So it's just simple things like that, can make a huge difference for people. So we released this one last year. So it's also available in online, so print and online. But this is specific to that greater Bendigo region, because that's the big quest is for. So we're developing the dementia care pathways, and we actually spell out the stage of dementia. So stage 1, 2, 3, 4, and 5. So understand that, people, do not always, I guess, identify or being diagnosed at stage 1. Some people are being diagnosed at later stage. So this is the way, I guess, for people to be able to, if you're receiving the diagnosis at stage 1, at least, you get some idea, if you like, what you will actually experience in stage 2, 3, 4, 5. And also in each step of the way, we actually provided the list of services available that would be relevant in that stage in their local area. So it's handy, if you like, you may not need it, all of them now, but if you do need it, you at least know it's all in there. So this is an example of, the directory that we produce. So giving people a bit more, I guess, idea about, where can they seek information, what kind of services available, some description, but also the contact details of that. So also have a postdoc student who completed last year, and her PhD was looking at, related to the project that we do in Bendigo, but looking at more around the built environment. So some of the areas that she was looking at, for example, is around, the messaging, the media messaging, the public news constructions of, the people living with dementia and their socio-spatial rights. Also looking at the, community stakeholders, and how, I guess, the council, the local government, how everyone actually treat people with dementia and the caregivers. And, and then we develop some discourse analysis following on that. So dementia-friendly communities, obviously, is a big part of what we do for our research groups, And it is a growing area in Australia at the moment. And obviously, you know, there's some continuing, I guess, lobbying happening from Dementia Australia at the moment for, you know, more support, I guess, for social special rights through advocacy, but also about, you know, the public promotion of the positive discourses. So instead of, you know, seeing, you know, people living with dementia as, you know, well, you don't have the right to, you know, the public space, you know, we need to be much more inclusive and, you know, actually try to think more about, you know, how we can, you know, make the living space, you know, more accessible and available for everyone. So the other part, I guess, of the research that I do is around technology. So particularly about, you know, independent living, you know, so, or smart housing, if you like. And this one is about the AI-based transportable homes. So what we meant by that is that, you know, we want, you know, to have people, you know, to be familiar with the houses that they live. And so, you know, the idea of building this prototype housing is that, you know, people can live in there and, you know, when, you know, they are at the stage where they can't actually no longer live, you know, in their homes, the whole house can then be transported out and being moved to be put behind the rural health service. So in the way, it's an aging in place sort of principle that, you know, the older person is familiar with, you know, the inside surrounding of their homes. This is my kitchen, this is my cupboard, this is my, you know, bathroom, you know, the layout, you know, is exactly identical. But then, you know, the surroundings is now, you know, within part of the hospital complex. So that, you know, if there is something happening through the sensors, you know, if the person is not moving or requiring some help, then the staff at the rural health service can easily just go to the backyard, to the back door, and go to the person's home to check the person's out. So it's a newer, I guess, ways to, you know, connect people. So we call that a cluster community. So we have developed the prototype and, you know, obviously, you know, we're going to have this cluster of these houses, you know, and the land is behind the health services. So we have got 2 sites at the moment. We are building at the moment, and there are quite a lot of interest coming, not only for dementia living, but also obviously for other areas. Like, you know, people living with disability or people living with complex chronic conditions. So the last, I guess, exciting project that, you know, that we've got funding for. So this is a $1.8 million project funded by the Commonwealth. It's around ecotourism. So we call that green care, respite care, or green connect care. So the idea is to offer options for people living with dementia and their caregivers to actually have respite together. So at the moment, you know, if you want to have respite care, you need to actually send the older person to a nursing home or to a long-term care. And then that's it. Whilst with this one, you know, we give people options whether they want to actually spend time, you know. So during the day, you can have a program, outdoors program, where there's a walking, you know, picking up, you know, grapes, fruits, whatever, you know, or doing things. And then at night, you can stay in the wineries, or otherwise, you know, you can probably, you know, have the persons, you know, staying in the aged care facility during the night, but, you know, the person can have a break, you know, have a spa, you know, in the wineries. So we have got that program running at the moment. We've just completed the first co-designed meeting workshops, you know, with all of the stakeholders in the consortium. So we're very excited to, you know, continue to work on this for the next 3 years. So this is probably quite important, I guess, in terms of, you know, like how we do research. It is quite a complex slides, but, you know, I think it's important to, whatever research we do, to me, it's all about, you know, bringing it all together. So it may sound or feels like, you know, I'm jumping all over the place, but, you know, all of these little puzzles actually bring everything together. So each of the parts that we do, obviously it takes time to develop a research project. We might have one big ideas, but no one will give us, you know, like $100 million now. But, you know, this bits and pieces, you know, over time will all need to merge and join together with the one purpose aim, which is, you know, to actually to maintain and improve the health and well-being, not only for older people or people with dementia, but also their caregivers. So you can see a lot of the, you know, like we're talking about the smart homes, we're talking about the cluster communities. You know, we've developed the pathways of care information. We also work with volunteers, with the caregivers, you know. So a lot of this thing, you know, it's all sort of comes together. So in conclusion, I guess, you know, we see about, you know, challenges with the aging population. You can see, obviously, you know, there's a growing need there. People want different things, at least in Australia anyway, in terms of how they want to grow old. And so, you know, for us as researchers is, you know, we need to listen to, you know, like what people want. And also the other thing is importantly is to look at, you know, what are the other opportunities there that we can actually use the resources that are currently available from the government, because funding is always be limited. And if we can't actually, you know, making sure that the research, you know, can be adopted, you know, and implemented in the mainstream, then pretty much, you know, we can't make any impact at all. So that's what we're trying to do at the moment is, you know, bring these bits and pieces together, work with the policymaker, work with industry partners, you know, work with the consumers, obviously, older people and the carers, you know, and trying to speed up that, you know, adoption of best practice evidence into practice and policy. So thank you very much for your time and happy to answer any questions.
Touching on what you mentioned at the end, I was wondering, two parts of what you were saying is, what sort of impact is all of this research having on policymakers?
So one of the, I guess, a good example of that is we are working with the government at the moment to provide some input into home care services. So that's probably quite a tangible outcome by demonstrating, I guess, you know, like the feasibility and the cost of actually doing this. That's something that, you know, the government can actually relate to. So we talked a lot before about return on investment, and that's pretty much what the government wants to see.
What's the population, general population, what is their reaction to it?
In terms of?
Well, in terms of what you're doing now, how much, maybe I put it this way then, how much does the general public know of the research that you're doing and what is their response to it?
So
I'm saying, asking
Yeah.
because governments are always driven by what the polls are telling them.
Yeah, of course,
You know,
yes.
and what's
Yes.
popular, so that's why I was wondering what
Yes.
the population of the class is.
Yes. So we are actually working with the marketing companies. And we are working closely with our media within the university. We have our own media department.
Mhm.
So I think that, you know, what I can say is that, you know, doing research now is no longer is so different to how, you know, I did my research 20 years ago.
Mm.
which is pretty much, trying to find the best idea. And then before anyone else steal my idea, let's just work on it now. And then try to get it published. And then I guess, be famous, like, I'm known for that. I think these days are different. These days, like we need to actually share what we do early on. So we do not need to actually wait until, we actually finish the whole study. We actually, like right from the beginning, even when we have a great idea, we do need to actually share the idea. We need to be open enough now to actually collaborate. Not necessarily asking for money, because sometimes, when I open my mouth, people will say, "You're here to want money." Well, yeah, if you have money, but sometimes you don't have money. But it's good to actually bounce some ideas, I think, because the ideas need to evolve. So it's not just one set sort of ideas. And that's how, the way we do the co-design is that, the more we get input, from everyone, not just the older people, then the better it is. And it's a much more rapid, I guess, adoption of the actual research. Yes.
You mentioned closing residential care homes.
Yes.
Why? Can you help me understand? We can't build them fast enough and you're closing.
The money. They can't, it's a business. So residential aged care, even though like the majority, well, public is one thing. I'm talking about the other part that's non-public, the private residential aged care or nursing homes. Mostly it's run by not-for-profit organizations. So it's usually like a faith-based, like a Christian-based, whatever, organizations. Yeah. Now, the problem is that, even though they're not for profit, it's a business. You need to have enough return on investment to actually float. If you're not bringing in enough money, you can't survive. Yeah. And with the government, putting a lot of pressure for example, like, they need to have, a continuous registered nurse. They need to have, this and that, and, a lot of guidelines requirements. It is so costly, and they can't get, the enough workforce.
Demand hasn't dropped. It's just economically unfeasible.
So the demand has dropped because people are too scared to come to a nursing home. The workforce, do not want to work in a nursing home. I mean, if you're a nurse, you might as well just work in a hospital and be part of a team, rather than, you alone having to front up like 50 beds of, very frail, complex care, older persons. It's with less money sometimes. So it's not, the business model is totally not there. It's wrong. Yes.
I'm just going to read a question that we've received online
Oh,
through the chat.
sorry.
So this
Yeah.
is coming from Vanina. She says, "Thank you so very much, Irene. Very informative and interesting." And then she goes on, "In Ontario, Canada, there's often great concerns about liability issues that stifle innovation and programs. So taking your ecotourism example, how do you get around these types of issues?"
That's why we need to work closely with the providers. So with the wine industries, with a lot of these operators, so we actually sit down with them to say that, okay, so this is what we want to do, and then we need to bring the lawyers in as well. So it's quite complex, but we need to be able to then, I guess, sort out, this one is covered, this one isn't. The same with the funding as well. Who's going to fund which component? And the same with the childcare, the intergenerational program before. To make it sustainable, it's one thing to have an idea and, like trial something. It's another thing to actually making sure that, what we do is actually comply with the requirement, and we can attract the funding from the government to sustain the program. So we need to get the funding from the childcare to sustain the childcare program. We need to sustain, the program from the aged care one, so that we can have staffing to do that kind of, interaction. So it is quite complex, but I think, once it's been sorted, then it can run, yeah.
think how with the residential like homes, there's less of a demand, but with the cluster care community being placed behind like our childcare centers like hospitals, that kind of veer on the side of, well, we end up with the same result, will healthcare workers not really want to go back and look at the cluster care communities, like what capacity of how many homes would be behind the sector, like managing that trade-off between the two.
I think that, the principle is slightly different because people live independently in the homes as opposed in that cluster community, as opposed to like, in your nursing home, like everyone, like 100% totally dependent on the residential aged care staff. So this one is more about, when there's an alert system, for example, if the person is not moving, then, someone will check on them. And it doesn't have to be someone from the health service, could be, if the person designated their, their carers or someone, the friend, whatever, to check on them, then that person will come first. So it's slightly less. There will be a demand, obviously, it's not going to be totally free of demand. But the idea is trying to minimize, I guess, all of this sort of effort to, if you can imagine that, if the person still live in their homes, for example, and in Australia, it can be like, you drive 3 hours just to check on whether someone is okay or not. 6 hours, so it's a full day though. One day, it's not sustainable like that.
Public-private relationship between
Yes.
the government and private, it's a big issue in Ontario.
Yes.
Can you comment how that works in Australia?
So there is a proposal recently. It's not legislated just yet, but there is a call at the moment to ask older people, with the income, sort of certain income threshold, to actually pay more. So there's a huge debate at the moment. So, like someone is to pay. The question is, who is paying? I know that some people are happy to pay more, and this is where, this balance, and there is also some discussion around, whether we should actually have a private long-term care insurance. So that's where we are having a debate at the moment around that.
But you do have private healthcare now, hospitals.
We do have a private healthcare for the hospitals. But not really for aged care. So aged care, pretty much you need to pay. If you don't have any money at all, then the government will obviously subsidize everything. If you are so wealthy, then you don't care pretty much. But if you're somewhere in between, which is most people, then, depends on, how many assets, how much assets have you got, your, income and this and that and whatever equity and whatnot, And in most cases, people actually have to sell their current homes to enter a nursing home. And then the funding will be kept as like a bond, if you like. And the problem is though, they do not have a say in managing it anymore. So the homes will be managing this
Your money.
money. And the homes will pretty much take out, your fee, your monthly fee or yearly fee or whatever fee is as required. You got no say, the family got no say whatever at all. And usually, by the time the person died, within 12 months or whatever, everything will be gone. You'll be lucky to get something better. Yes.
In Ontario, there's a fairly common practice that as one of a married couple enters the non-conforming,
Yep.
legal separation groups are provided.
Yep.
So that the co-payment
Yep.
that the family has to pay
Yep.
is significantly less.
Yep.
But of course, this causes a lot of stress between married couples because
if for someone who has a cognitive impairment, to explain to them that
Yeah.
you can separate, the individual has to sign. it,
Yeah.
Or
Yeah,
capacity of consent becomes involved. And similarly, in Ontario.
Yeah.
More insurance companies are offering more secure insurance plans.
Mm.
Exactly as you described, it's very interesting to see all these economic backdoor approaches to us, reduce how much you have to pay.
I know.
government.
So, when I give a community talks, to older people, I always say that, the first thing you need to do is get your finance sorted. People look at me like, why is you just talking about money? Well, I'm just saying though, whilst you're still healthy and able to, the first thing you need to look at is your money. Because, in Australia, we have rules that, a lot of people trying to save their money by trying to, put everything into their kids, right? And then they go to a nursing home. You can't do that. We've got this, this 5 years law. So if you just bequeathed, the house, the property, whatever to your kids, you still need to pay, the government will still count that as your, income sort of, unfortunately. Yes.
So my question may be a little offside, and if it is, we can find the answer. Let's move to China. China instituted a one-child policy,
Yes.
which has given them now a terrible demographic disaster.
Yep.
What do you know about, or what do you think about what's going to happen with China demanding millions and millions of Asians to come and give care to be carriers?
So, I did a project actually just before COVID actually. Thank God before COVID. Otherwise, the study will not finish. In China for that particular reason. I was actually quite so I'm Chinese by background. Well, I can't speak Chinese. So, but I live in Australia for too long. But I was interested actually, to look at that myself. So we did a study in Beijing actually, and we look at a lot of older people in China actually live in the countryside. So I'll just be quick. So the one who lives in the city is mostly their kids. But the people in the rural area, they actually migrated, and live with the kids because they need to look after the grandkids. So that's where I guess when we talk about the value, that's where everything sort of fits, I guess, and the problem only we saw the problem when as the kids grow older, then these older people, because it's mostly the 2-bedroom apartment, then they need to actually move back to the rural area. And then, they're being sort of not left in there, but it's pretty much that's the system at the moment. So it's not, it's still not a rosy, I guess, picture. And, it's a lot of tension and strain for the Chinese young people in particular, because they are in the sandwich generation. They need to look after, like 2 sets pretty much of the parents and 1 child. Well, they can have more now, but, still, I guess, a long way away. Yeah.
Can I get one quick one in?
Sure, yeah.
You talked about the 3-hour drive out and 3-hour drive back.
Yes.
Checking somebody. The internet in Australia, is it by a satellite, by a cell phone, by a fiber? How does the internet work in Australia?
I think all of the above, but we do have quite a lot of what we call it black spots.
Okay, dead spot.
Yeah. So it's not that good. And the problem is though, even if the health service, actually has, a lot of the internet, telehealth, whatever, if the person on the other end, do not have any tablets or computer or whatever, or even phone, it's not going to work, unfortunately. So that's why, we part of the reason why, we work closely with the rural health services and the whole of the community is because we want to make sure that this is sustainable. And one of the way to make sure that our research is sustainable is we work with the local people. Because otherwise it's going to be like fly in and fly out, you know. Well, not quite. I live in the regional area, but it's, you know, I'm not there all the time. I mean.
Well,
Yeah, thank you so much, Dr. Barber, for coming and sharing your research.
Thank you. Round of applause.
Thank you so much. Yeah, and just before we all pack up, I just wanted to direct your attention to the next seminar, which is gonna be in March. It's on Wednesday, March 20th, same time, 2:30 to 3:30. We're gonna be having Dr. Wendy Harcourt, and the presentation is going to be on intergenerational dialogues on gender, age, and caring. So it's gonna be in the same room, or you can join on Zoom. So hope to see you guys there.
Yes, and just to also flag that Wendy will be here in person, just like Irene was. So we do encourage you to come in person if you're able to. If not, we'll see you via Zoom. And thank you everyone for coming.